2 minutes after 9 o'clock at St. Johns County's 103.9 FM and AM Radio 1170. Hope you're having a good Friday morning, TGIF Friday. Gina Thorne is with me here live in the studio. She's going to help us play some music, and we're going to talk about Lakeview Health. And if you are out there struggling with drug and alcohol addiction, or you know someone in your family, circle of friends, neighbors who have a friend or a contact who's also struggling with drug and alcohol addiction and want to get to a better place, a place of recovery, then we've got some good information for you over the next hour. We're going to keep playing some music, and we're going to learn something. Right, Gina?
Always. How are you doing today?
Well, good to see you.
Yeah, it's been a couple weeks.
It's been a couple weeks. You know, Gina left us. She went on this cruise around the world. And,
I did, and got burned. I got very burned.
Really?
The
sun doesn't look that way.
Well, it's had a couple weeks to kind of get it under control, but Grand Cayman, the sun's a little hotter down there than it is here.
It's hard to imagine.
Mm-hmm. That's right.
But I guess that's the case. You brought along two very special guests today.
I sure did.
Want to introduce those to our audience?
Yes, I have Ashley Harms, right?
Yes.
Ashley got married recently, so I know her as Ashley Madden. And then I have Ben Ertl. And Ben and Ashley are aftercare coordinators for the Rose and the Star programs.
All right. Well, thank you both for being here.
Thanks for having us.
Yeah. So the Rose, let's go back a little bit. Let's talk about those two programs. Gina, maybe you can give a quick summary of what those are.
Sure. So the Rose is our women's specific program. We work with women 18 and over with substance abuse and mental health disorders. We just opened in May. It's a terrific program for ladies who are struggling with bipolar, depression, anxiety, who are also struggling with addiction issues. So they may have alcohol concerns. They may have issues with opiates. Our focus is to help them get off the addiction and get focused on recovery, and then also address any kind of mental health issues that are going on. We also address a lot of issues that go on with trauma as well, and we can talk more about that later on. And then, of course, Ben works with the STAR program, which is our men's specific program, and that program's been just a terrific opportunity. Ben and I had a chance to talk a little while ago about the power of bringing men together in recovery and what that's been like. And so it's just been a really neat opportunity. I think they both have some very unique stories to share about working with our patient population and watching these people get sober. So we'll talk more about that too.
All right, good stuff. Well, once again, if you have any questions at all about Lakeview Health, you can go to the website, which is lakeviewhealth.com. That's lakeviewhealth.com. We'll put all this information up too on our Facebook page at WSOS Radio, so you can access it if you're driving around. It'll be there when you get back in front of a computer again. You can also call this number for any information anytime, 866-316-5113. That toll-free number again here in Northeast Florida is 866-316-5113. I'll tell you what, we are going to take a break, and then we'll be right back. Pure Prairie League here on St. Johns County's 103.9 FM. It is about 12 minutes after 9 o'clock, already up to 85 degrees, on our way up to a high of 93 degrees, and a real temperature this afternoon with the humidity and all that. It's going to feel like 102 degrees this afternoon, and Gina Thorne says, bring it on.
That's toasty.
Yeah, she looks up at the sun and says, that's all you got.
I'm the sun goddess now. Bring
That's
it over.
right. That's right. So she's doing great. And Gina Thorne, we appreciate her coming by here, and Lakeview Health being a part of our family here at WSOS. And on Fridays, we spend some time learning about the different programs for drug and alcohol addiction recovery that are available very close by at Lakeview Health here in Northeast Florida. Learn more by going to lakeviewhealth.com. Gina brought along two special guests this morning. We're excited about that. Maybe you can reintroduce your guests and talk a little bit more about recovery and what life's like after you leave Lakeview.
Sure. So Ashley and Ben are here, and both of them work with our patients before they discharge. And so I wanted to have them talk with our audience a little bit about what we do at Lakeview in regards to post-treatment experience, because a lot of people are always coming into our program and then they wonder, well, now that I've got this whole sobriety thing down and I've been in treatment, what do I do next? And so I thought it'd be great for you guys to talk a little bit about that. So Ashley, why don't you tell us what you do?
Yeah, thanks, Gina. I see so many women go through treatment and they think, okay, I'm done now. I mean, I've been here 30, 60 days and I've got this. And that's simply not the case. A lot of those triggers don't happen until people leave primary treatment, and that's where Ben and I come in. We make sure that all of these bases are covered, whether it's, continuing their care at a sober living facility, an intensive outpatient, individual therapy, medication management, alongside, daily 12-step meetings. It's so helpful to have as much structure early on in recovery as possible.
What's the track record, you think, when folks are leaving? I mean, a lot of people say, well, 30, 60 days because maybe that's what insurance covers. I've achieved some level of sobriety, and then they start working with you on what life is going to be like after they leave Lakeview. But what's realistic to expect?
Oh, I mean, track records such as,
likelihood to relapse, that sort of thing. And if they do relapse, are they still going to be able to pull back to sobriety? I mean, what have you seen over the years?
It's a really difficult question to answer. It's a lot of self-reporting.
Right.
So a lot of our patients come from out of state, and we have a great alumni association that keeps in contact with them.
Right. What do you think? What do you see, Ashley, that works best to help people stay on a path of sobriety and recovery? I mean, what are the things that are out there after they leave Lakeview that you from your life experience, the things that are most important that will really help people stay in recovery?
I'm a person in long-term recovery, and I had to change all my people, places, and things. And I was
change the people you hang out with. Mm-hmm. Okay. Change the places, like even where you lived.
Sometimes that's necessary. I happen to stay in Jacksonville. I'm a Jacksonvillian.
Is that what you call you people?
Yeah, it is. That
okay.
is.
All
Or
right.
sometimes Jacksonvilleans. Who knows?
Yeah. We just point north down here. And
Right.
say that, I don't know what they do up there, but we're St. Augustinians. We know what that's all about.
We play Pokemon mostly.
Yeah, that's what we thought.
Right. And getting sober so young, I was 21 when I came into recovery, and at that age, I'm just able to drink legally.
Right.
So my life is over. I was in college, and it seemed like nothing, what am I going to do now? And getting plugged into 12-step groups, it's so helpful because life is nowhere near over.
Yeah. If you don't mind me asking, how long have you been in recovery?
A little over 4.5 years.
Wow, congratulations.
Thank you.
That's very good stuff.
Life is better than ever.
I would think, too, when you are at Lakeview Health and you're working with the patients and clients there, the fact that you're going through this, that you're on this road, means a lot to people, right?
It does, it does. And that's not to say that, someone that does not have the same experience that I do is not as helpful.
Right.
Because they are. We have extremely knowledgeable staff, both in recovery and not. And I think we're all an asset to the team equally.
What do you think is the one thing that people like us who may be family or friends trying to support people that are on the path to recovery, what's the one thing you wish we understood better?
Oh, one thing.
One of the more important things that we need to understand.
One of the most important things to understand, I think, is it's not really a choice at times. It's a lot more powerful. I can't tell you how many times I heard, why don't you just stop?
Right.
And it wasn't that simple. I wanted to more than anything. I couldn't.
Right.
And I needed that psychic change to occur, and enable me to live this different lifestyle.
That change, when it happened, was it a bottoming out? Was it a light switch that suddenly flicked one day when you woke up? I mean, how did the transformation happen in Ashley's life?
In Ashley's life, we
love when people talk about themselves in the third person, by the way.
Yes.
It just makes it more fun.
I feel more important doing it. I hear so many people talk about financial bottoms, and, I was living under a bridge or something like that stereotypical, picture of an alcoholic or someone with a substance abuse issue. And for me, it just wasn't that way. I had a great job. I had a 3.5 in my undergrad program. Everything.
You were a high functioning addict.
I was very high functioning. And from the outside, life looked perfect. But inside, I was miserable.
Oh.
And that was my bottom. It was an emotional bottom. I didn't like who I was. I didn't like, how I interacted with myself. I couldn't be alone with myself. And it was a pretty miserable existence for a while there.
Now, Gina, she seems like a really happy person.
Yeah, we're really excited to have her on board.
Yeah.
She's been able to take a lot of her strength, hope, and experience to really make a difference with the women, and not just the women, because we've moving into this gender responsive program. But prior to that, she worked very closely with our males as well. And so really been instrumental in helping our patients really look at there is life after treatment and creating that safety net of support, which is so important because a lot of people are very nervous. They've been in this incubator of treatment for 30, 60, 90 days, and then they're like, okay, now I have to go back into the real world and face my real world challenges, and I don't know how to do that. So having people like Ashley and Ben at Lakeview allow us to give them that peace of mind so that when they leave, they've got the support that they need, whether it's engaging with a 12-step community, finding alumni buddies, being in part of an IOP program, looking for a good sober living program. All of those pieces are put together, and we only partner with those people that are like-minded like us, that are really doing things the right way.
Very interesting stuff. Once again, that's Gina Thorne with Lakeview Health. You heard from Ashley before that. We're going to hear from Ben in just a few minutes, so stay tuned for that. And, of course, Ashley very involved with the ROSE program at Lakeview Health, which is a gender-specific program. We're going to learn more about all that as well. You can learn more on your own terms if you're getting out of your car and you're not going to be able to listen to us any longer. Check out the website, lakeviewhealth.com. That's lakeviewhealth.com. Or call this number, and they'll be happy. You can talk to a live human being who'll answer any questions you have just about any time, day or night, 866-316-5113. And we have all that information up on our Facebook page right now at WSOS Radio. That's Pilot here on 103.9 WSOS, and we're spending time with Gina Thorne from Lakeview Health, and you can learn more by going to lakeviewhealth.com. Maybe there's someone in your family, your circle of friends, a neighbor's friend, it doesn't matter, but you've heard of people or an individual that's having trouble with alcohol and drug abuse, and they're trying to search for a path to recovery. And Gina, you guys can help them out. You do it every day.
Every day for almost 15 years, absolutely. Yeah. And so we treat people 18 and over with substance use disorders and mental health disorders, men and women. We just moved gender responsive in the last month, which has been terrific. The program has really evolved, and we've really created a pretty special place. The facilities are amazing. We built this $20 million infrastructure that supports the clinical program. So when you walk into our program, it doesn't feel like a hospital. You don't feel like you're walking into a psychiatric facility. You really feel like you're walking into a place where you feel worthy. You feel like you're going to a place where you can actually get better, and that life's an opportunity at this stage. So, and we've got really special people that work with us, and you had a chance to hear from Ashley, so I'm really excited to talk to Ben about, what his experiences are in working with our male patients, but also hearing about his extremely important job of managing the Pokemon Go that comes to our campus. This is a big deal. This is a new role for Ben.
So in case you've been living under a rock, this whole Pokemon Go thing is something you can download an app on your phone, and it basically controls your life. It makes you go to all sorts of interesting places, including where you can go and hang out with Ben, who I guess in the virtual world of Pokemon Go, you're a really tough guy security agent, right? Or security guard, rather.
It's a new role, and I'm really trying to...
You've embraced it?
I'm embracing it wholly, but really trying to learn the ropes. So,
yeah, that's so crazy.
Yeah.
Well, Ben, of course, is part of the STAR program, which is the men's program at Lakeview Health. And so maybe tell us a little bit about your story and how you got to a place where you could help men that are dealing or trying to achieve recovery and sobriety.
Yeah, absolutely. I first reached out to help way back in 2009. I didn't know where to turn, what to do. Neither did mom and dad. We started Googling things and asking pastor and whoever we felt comfortable with telling, and didn't really get a whole lot of answers. It wasn't until December of 2011 that I really found my entrance into recovery, and it was not in a nice, pretty setting. There were bars, and there were a lot of men with badges, and that's just my story. And I'll tell you, I went to a couple different detoxes, 7 days, would leave, go back to mom and dad's, go to some meetings, get this over with. When I reinserted myself into the place that I was before, and my spirituality hadn't changed, my mind hadn't changed, I was still the same person, just removed from drugs and alcohol. I failed every single time. And so luckily in 2012, after a stint and some lockdown treatment, I was fortunate enough to be asked to go to a sober living home
Right.
That's where my life changed. I stayed there for 18 months, finally learned how to work a program of recovery, become a man. I was 26 at this time, and didn't have anything to my name, didn't have any solid ground really to stand on other than mom and dad.
Right.
And they were pretty done with me at that point as well. So fortunately enough, formed relationships with a lot of good men, and was able to finally start recovering from this disease. And that's what I tell guys all the time. They come in and they want to go back home. They come in with the inclination that they're going to come to residential treatment and be able to go back home and live with mom and dad and find a job and finally do all these things that they wanted to. But what I walk them through is, imagine walking into that bedroom that you've been sleeping in the past couple years, and all those memories and all those, the sights and the smells are all the same.
Right.
The sensory, it's all the same. And your mind isn't, cleaned yet.
Right.
Your body's clean. But, there's a lot of work to be done. Let's try something different. Let's go to a place where it's structured. Let's go to a place where everybody in there is trying to work a program, hopefully everybody in there, and you can really embrace this new life and give yourself a solid foundation before you return back to be around family, if that's what you want to do. And, I would say a good amount of our younger men, that's definitely a route that they choose to go, and that's great. And we see, there's tons of success there. Another thing that helped me was an outpatient program, and, being able to go to work, come home, eat dinner, and then go and continue my clinical therapy, so that, and that dropped down over time. I spent a year going through, intensive outpatient to an outpatient setting to an individual setting. And that's something I stress as well, with anybody, whether you're going home to a career and a wife and kids. Outpatient programs are all over this country. We know of great ones. We get to meet people all the time in our community and throughout the nation that run awesome outpatient programs with great therapists, and they'll help keep you accountable as well. And it really gets you connected to the community around you. You're with other people who are going through the same struggles in your groups, and you can kind of bounce off of them. What do I do on a Tuesday night? Where do I go on Saturday? And these are people who are going to other 12-step groups, who are engaging in other fellowships around your community that you can bounce your ideas off of and start to recover. So.
Right. Talk to me about, when you're working with men who are in the process of starting to transition out of Lakeview, what do you think is maybe a gender-specific issue that they have to deal with? I guess there's always relationships, and we can go back and we should talk to Ashley about that because, obviously, even though, the men that are trying to achieve recovery, there's still, the interest in the opposite sex, right? There's still
Absolutely.
the possibility for romance and all that, but it's coming at a time in life when, man, there's so much stuff going on in your head, right?
Mm-hmm. And that's something that, the gender responsive programming has been a huge weight off of our shoulders as Aftercare Coordinators. People really kind of jeopardizing their own recovery because they're going to place themselves as close as they can to this person that they've known for 30 days.
Yeah.
And having that barrier removed and being able to at least get them into a good aftercare setting without that idea in mind has been pivotal, and it's going to continue to be. But yeah, everybody wants to be in that location where they're gonna, not everybody, the younger men especially, that's one of their first goals. Let me find a girlfriend. And I think really it's part of that checklist of how do I get back to normalcy?
Right.
Have a relationship, have a good job, go back to school, complete school. These are all checklists that people have in their mind. But for that first year, we would really stress, hey, maybe talk about these 12 steps. Maybe that first job looks like something more like 25 to 35 hours a week as opposed to full time.
Right.
Learn how to show up on time. Learn how to keep your laundry and your house good. Life skills. Mm-hmm. And that's something I really focus on with men's programs is those life skills. It's having a young man who has never been able to really take care of himself outside of getting up every day and maybe taking a shower, and getting those life skills into him in that first 3 or 4 months, so that he can grow and he can continue and form a healthy relationship when appropriate, is pivotal. So
good stuff. Well, once again, that's Ben, and he, of course, works with the men at Lakeview Health, and of course, they enjoy some tremendous success, right, Gina Thorne?
Always. I mean, we love watching our guys come in, and they're usually in a really bad place. They feel pretty hopeless, but once they walk in through our facility and they have a chance to take time to really work on their own work, a lot of people don't do that very often. We see a massive transformation happen, which is really terrific. So we certainly do invite those that are listening today who are struggling, or if you know someone that's struggling, to give us a call. We've got folks on staff right now who are ready to talk to you. There you go. Well, once again, go to the website, lakeviewhealth.com. That's lakeviewhealth.com. If you're driving around, we encourage you to check out our Facebook page. We have the telephone number as well as the website there. Easy to access at WSOS Radio on Facebook. And we're going to be back once again with Gina, Ben, and Ashley. We're live in downtown St. Augustine.
Notorious. Oh, Lord, please don't let me be misunderstood. Yes, I'm just a soul whose intentions are good. Oh, Lord, please don't let me be misunderstood.
The Animals, Don't Let Me Be Misunderstood. Kind of an interesting song, huh, Gina Thorne?
I feel misunderstood all the time.
Oh, you are misunderstood. We understand you clearly right now, Gina Thorne. We're talking about Lakeview Health, and of course, you've been a part of the team at Lakeview Health for quite some time.
3.5 years.
Yeah.
I joined 3.5 years ago. I relocated myself and my family down here from Virginia to work at Lakeview, and Lakeview's a really cool place. We actually, there was very little known about our program, even though we'd been in the community for a long time. And so I was invited to come down and help the community and learn more about who Lakeview was. And so now we're actually nationally recognized, and people come from all over the country to seek out treatment and look for good recovery and sobriety.
And you get to work with great people like Ashley and Ben.
I do.
Who would be unavailable anywhere else.
I know, exactly. I mean, this is like, we feel like we're so lucky. And, it's also really cool is that both Ashley and Ben are young, and they have a great opportunity to relate to a lot of the young people that are coming into treatment. And so what's terrific about that is that they can use, again, I mentioned earlier, their strength, hope, and experience to really help a lot of our young people who are coming into a program, because many of them, I think, are failure to launch. They're living on sofas with their mom and dad. Mm-hmm. Mom and dad are like, you know what, I'm done with you. I'm not going to allow this to happen anymore. And your choices are you either go to treatment or you're going to have to get out of my house. And so we do have those resistant, right? Absolutely. We have some resistant men and women that come into our program. But being a young person in recovery, I mean, what do you guys think? Is it a cool thing now? I mean, it seems like it's a hip thing.
Well, Ashley wouldn't say I'm young, by the way.
Right.
Oh.
Some of us are younger than others.
The 30-year-old threshold has been crossed, and now
you're firmly an adult now.
I've broken it.
That's right.
Yeah. Ashley, on the other hand,
I'm ripe old 25.
Yeah.
A baby.
Right.
Yep.
Mm-hmm. Man, we're just a tad older than that, Gina.
Yeah, I think you and I are probably looking at the other side of that. So, but no, I think that the concept of what you guys have been able to kind of showcase at our facility in regards to being that face of folks when they come in is really terrific, because it's like I can be like them. I can actually see what recovery looks like and how wellness can be for me. So I think that's pretty neat.
Absolutely. I mean, it's just a growing movement. I can't remember the last time I watched, an episode of Chopped that there wasn't someone in recovery on there. Mm-hmm. And it's amazing. The stigma is really getting broken.
Mm-hmm.
Yeah. What do you think is the difference, actually? Ashley, Ben, obviously you deal with men who could be in their 30s, 40s on up, and they're in recovery. They are at Lakeview Health getting better. But you also work with men that are in their early 20s. Mm-hmm. What's the difference in the worlds that those men will go into based on their age? Do you see anything distinctive?
Yes, absolutely. Like Ashley had shared earlier, when she was 21, when she got sober and she thought life's over. So young men definitely have to face that. The idea of, not going to the bars with your friends and not having a beer with your kid and all this stuff, all things that you thought of like as you grow along in life, like that were just kind of intertwined in your images. And then you have the older men who are probably set in careers, or at least will be in that setting, and they have to face that question of, hey man, do you want to go to happy hour after work? You want to come watch the game? What do I do when I get to your house and you offer me a beer? It's as you engage in 12-step fellowships and you go to men's meetings, which I've been going to a couple different ones these days to try to kind of grow in some of this stuff. All that kind of falls apart. We'll have 18-year-olds coming to treatment, and 2 weeks later, all you ever see them with in our bistro, our restaurant setting, you'll see them sitting with a 50-year-old guy, and they're buddies, And so to be able to glean from the older gentlemen who are just as new in recovery as you, but have these whole set of life experiences that you don't, it's really cool to watch, and that's what they're going to be doing if they enter into long-term recovery. So.
Very interesting stuff. From a female's perspective, Ashley, what do you see, the challenges being, maybe one or two key challenges that a woman, in her early 20s, coming out of the sort of college age or post-high school life and trying to get into recovery, just like what you did? I mean, what are the challenges they are going to have to deal with head on?
Women tend to be more caregivers. So despite the age, we have a lot of young mothers that come, and that's definitely a barrier to continuing treatment. They have a family they need to get back to. They're usually, the ones that keep the household running, regardless of age. And that's definitely a barrier to explaining, You have to get this recovery thing down first, because without your sobriety, everything else is just going to fall to the wayside.
That's Ashley. Once again, Ben is here as well, and they're both part of the professional team at Lakeview Health here in Northeast Florida. If you know somebody in your circle of friends, family member, neighbor, somebody that's just reaching out, trying to find out, where is a place that they can go for rehab, where they can go and try to find a path to recovery, we would encourage you to make sure they know about Lakeview Health right here in our community. That's lakeviewhealth.com. lakeviewhealth.com. You can call toll free. We'll give this number out again before we get to the top of the hour. 866-316-5113. That's 866-316-5113. Gina, any thoughts?
It's interesting. I was listening to Ashley talk about this issue of women and the fact that there are these barriers. And we've got a terrific clinical team. We're headed up by our chief clinical officer, Dr. Hemphill. And one of the things that we've learned over the last several years in regards to women in recovery is that women are much less likely than men to access treatment over their lifetime. And part of it is, as Ashley mentioned, there's a big stigma tied to it. But there's also a lot of family issues. There's a lot of trauma issues. A lot of them don't feel like they're worthy of going into treatment, and so they really struggle with that. Women advance more rapidly from use to regular use to first time in their first time. So you might have a male that drinks at the same rate as a woman does, but her addiction will progress a lot faster in some cases. Some of it's biological. So you really have to be mindful of the fact that as a woman, you've got, it feels like women are always up against something, doesn't it? It's like we always have to remember that we've got things that we're going to need to address pretty quickly. And what's great about the Rose is that we've customized a program unique for women so that they can respond to those barriers.
Interesting stuff. Gina Thorne, once again, with Lakeview Health. We're going to come back and wrap up our time with these folks, so stay tuned. It's about 10 minutes before 10 o'clock. St. Augustine's 103.9 FM and AM 1170, and we're wrapping up our time with the good folks from Lakeview Health. And if there's somebody in your circle of friends, contacts, family members, and there usually is, right, Gina?
There always is. This disease affects 1 in 10, and so sometimes we might not even know the person next to us is struggling with this disease, and so certainly keeping yourself open and willing to listen to them is really important.
Yeah.
We struggle with this disease getting to treatment because there's such a stigma attached to it, so We try to help people understand that this is not a moral weakness, that this is a brain disease that needs to be treated no differently than everything else. So
we're talking about drug and alcohol addiction, and Ashley and Ben have been here with us as well. Gina joins us every Friday morning around this time. We play the music. We learn about the great work of Lakeview Health in our community here in St. Johns County. And Ashley, as a young person, you were talking earlier in really powerful terms about how you came to terms with addiction and how you're on the other side now, and gosh, over 4 years sober, right?
That's correct.
Congratulations.
Thank you.
For people that are listening to us right now who are moms, dads, aunts, uncles, friends, whatever, and we suspect that there's somebody in our life who is struggling with alcohol or drug abuse, what can we do to try to nudge that person toward experiencing Lakeview Health or trying to get toward recovery? Is there anything we can do? Sometimes you hear in the popular press, or if you watch too much Dr. Phil, that somebody has to hit rock bottom, but in reality, I don't think anyone who loves and cares about somebody else who is struggling with addiction, we all want to do something. So what can we do, or is there anything we can do?
There's a couple different routes to take. I know that some legal intervention helps at times.
Right.
For
Seemed to help Ben a lot.
Yeah, for a lot of people.
Yeah.
And Lakeview's website has a lot of great resources for interventionists on there.
Right.
It's really tricky. I would definitely say if a family is going to breach this, do it the right way the first time. And that could require some professional help getting someone that knows how to set those boundaries, how to react to the manipulation that goes along with active addiction. It's really tricky when families try and do it alone.
Right. So maybe the best first step they could take would be to call the toll-free number, right, and get
Absolutely.
some helpful hints. Obviously, look at the website where there's some good advice, too, about intervening and trying to help out, because I do think there are a lot of people out there listening who suspect that their loved one, regardless of age or gender, has a drug or alcohol addiction issue, and they just want to try to help in some way. So the first step you can take, and it won't cost you anything, is to call this toll-free number, 866-316-5113. That's 866-316-5113. That telephone number is up on our Facebook page, too, at WSOS Radio. And, Ben, what are your thoughts about that? People out there listening to us, there's a man, boy, whatever you want to call them, in their lives, and they are obviously, from the loved one's perspective, struggling with drug and alcohol addiction. Is there anything they can do?
Yes, absolutely. And I don't know, most recently on the show Intervention, there was a young lady from St. Augustine. So understand that this is prevalent in your community. I always remember those moments when I'd break down and want to cry out for help, but was just too scared about what the future looked like. I knew I was going to get sick. I knew people would be more ashamed than the people that actually knew already and were watching me. There's a stigma attached to drug and alcohol addiction. And what you need to understand is that the people that hold that stigma don't understand the disease. And there's this vast array on the other side that does, and it's a much more beautiful life. If you don't think that, if you have a loved one that enters recovery, you better believe that your life is going to improve as well because of their recovery. Because then you get into recovery from, having that person deal with this, but also watching them grow and watching their life completely change. We're not just talking about putting down drugs and alcohol. We're talking about starting to rid yourself of character defects and really improving your life wholly. It's really a holistic change that goes on. And so just understand that, yes, there will be there's dark times now. There may be dark times in the future, but what lies ahead is beautiful. And so do not hold back from, just sending that text message or making that call and just saying, hey, I've looked into some things. Would you want to go to a meeting with me tonight? There's open meetings all over the place. If you want to go with them, feel free. They can hear the help. They can hear the experience, strength, and hope from somebody who's been through it. But like I said, there's that fear of getting sick. And so at that point, reach out for professional help. And understand that detox does not have to be painful, does not have to be terrible. There can be a very comfortable yet understanding that goes through with it. So you get to experience a little bit of it, and that's good because that helps in future experiences, in my opinion. But it can be very comfortable, and there is help, and it's affordable, and it's all over your community.
There you go.
So
good stuff. Well, thank you, Ben. Ashley, thank you. Thank you both for sharing a very your personal stories. They're inspiring, and congratulations on your path and what you're doing professionally with Lakeview Health.
Thanks.
Yeah,
for
good
having us,
stuff.
Kevin.
No, thank you. And Gina, good stuff. You know,
Yeah.
got any closing thoughts?
Just want to thank WSOS for giving us this opportunity to talk about recovery and sobriety, and how, I loved what Ben just said, is that it is a beautiful life, and that we want to encourage those that are listening today to give us a call today. We know that you don't have to live in this chaos and pain anymore, and that we are the solution.
Absolutely. All right, Gina Thorne, thank you very much. Once again, check out the website, lakeviewhealth.com. Share that website with somebody else who can obviously benefit from it. That would be a very good thing to do today and this weekend. It is exactly 10 o'clock. It's St. Augustine's WSOS FM 103.9.